Attention healthcare enthusiasts and tech lovers. Welcome to Reimagine Podcast Season 2. In this episode of the Reimagine podcast, we explore Maryland's patient-centric healthcare system. Our guest, Sunil Madan, the Chief Medical Officer at Luminis Health and a renowned expert in healthcare innovation and population health, shares his insights on the topic. Don't miss this thought-provoking conversation. Stay tuned.
Hi, and welcome to the Reimagine Patient Engagement Podcast. This podcast aims to answer the changing dynamics in patient engagement. What role does technology play in the space, and what are the key initiatives and metrics each individual in the ecosystem expects? Let's get started.
Welcome to Reimagine Health. My name is Donna Rice, the host of this podcast series. Today we are joined by Dr. Sunil Madan, the Chief Medical Officer at Luminis Health. Dr. Madan is a leader in population health and healthcare innovation. He has an impressive background, and we are thrilled that he can join us today. Share with our audience a bit more about your background and how you became so passionate about population health and healthcare innovation.
Great. Thank you, Donna, for having me on the podcast. So in healthcare management and in practice for 22 plus years in the Washington, D.C. region. Initially did my training at UC Missouri, Kansas City, and then my residency at Emory University in Atlanta. And then finally ended up with MedStar, a 12-hospital not-for-profit in the region, where I helped manage the ED for a tertiary teaching hospital and a series of other hospitals in the region. Subsequently became the Chief Medical Officer with Luminis Health Doctors Community Medical Center, the newest system in the state of Maryland. Where I got passionate about population health is that in Maryland, we are under what's called a global budget revenue and a waiver for Medicare, how we paid for taking care of patients in the state of Maryland. We are incentivized to take care of patients and population specifically, rather than just those that may be sick who come to your institution. So it became second nature to me based on my day-to-day work in taking care of populations and making their health better. And interested in innovation, specifically when I was at MedStar, started working with Dr. Mark Smith, who's head of Center for Innovation. We developed a product there that was subsequently acquired by Microsoft. There was a data warehouse and had other tools, and got into passion with technology and how technology can help solve the gap in health.
Head to the link in the caption to listen to the full episode.